Today, I will be speaking on a topic that is often overlooked, yet deeply impactful: dark radiology, the misfits in radiology practice in Nepal. So, when I say in Nepal, I don't think it gets limited to Nepal only. It is happening throughout the subcontinent, I feel. Radiology has become the backbone of modern diagnostic medicine. From early detection to treatment planning, imaging plays a critical role. However, behind this advancement lies a darker side: hidden inefficiencies, ethical concerns, and systemic gaps that we must address. Unethical practices, gaps in standards, and misuse of radiology is what I'm trying to refer as dark radiology. It includes overuse, underuse, and misuse of imaging, driven by systemic and human factors. And I will be mainly focusing on ethical, operational, and systemic misfits in this aspect. When we say dark radiology, we refer to the unseen challenges: unethical practices, inappropriate imaging, and lack of standardization. This includes overuse, underuse, and misuse of radiological services. Let me ask you, how often do you encounter unnecessary scans in your daily practice? So this is a question for us all to brood over. We get plenty of such unnecessary, isn't it? Unnecessary requests. In context of Nepal, we are witnessing rapid growth in imaging facilities, especially in urban areas. However, rural regions still struggle with access. This imbalance, combined with limited regulatory oversight, creates fertile grounds for systemic issues. So that is the growing trend of radiologists in Nepal. So if you look from the year 2014 to 2024, the number of radiologists have increased in a very steady number. Today we are having around 600 plus NRA life members, and there are around 900 NMC registered radiologists in Nepal. The types of misfits that we'll really focus are unnecessary imaging, underqualified operators, equipment misuse, reporting delays, and ethical violations. Unnecessary imaging is often driven by financial incentives. I repeat, by financial incentives or defensive medical practices. But at what cost? Increased radiation exposure and financial burden on patients. As professionals, we must ensure justification for every scan. There is a significant shortage of trained radiologists in Nepal. This leads to over-reliance on technicians and increases the risk of diagnostic errors. Additionally, brain drain continues to weaken our healthcare system. In ethical concerns, the commercialization of healthcare has led to compromised ethics in some areas. A lack of accountability and transparency erodes patient trust, something that is very difficult to rebuild. So this has a very big impact on healthcare. These issues collectively lead to misdiagnosis, delayed diagnosis, increased cost, and ultimately reduced quality of care. And at the center of all, this is the patient who suffers the most. So these are how the various modalities in Nepal are rising. All this leads to a very strong role of regulation. Strong regulatory frameworks are essential. We need proper accreditation systems, monitoring and enforcement of guidelines to ensure quality and safety. Teleradiology offers immense potential to bridge the urban-rural divide. However, without proper regulation, it may introduce new risks. Thus, balance is the key. So on the perspective of BIMSTEC level, I feel BIMSTEC collaboration can play a vital role. Sharing best practices, training opportunities, and policy frameworks can strengthen our collective capacity. The only way forward is involving and strengthening the education and training system, promoting ethical practices, investing in infrastructure, and enforcing policies effectively. So we are making lots of policies, but its implementation is always delayed. This is how the IR radiology centers in Nepal are looking. So most of them are concerned within the Kathmandu Valley. But now I think there is much increment out of the valley too. So the call to action needs collective responsibility. Radiologists, policymakers, and institutions must come together with a shared commitment to quality and ethics. Ethics, I think, is very, very imperative. In conclusion, addressing dark radiology is not optional. It is very, very essential. Let us work together to ensure a safer, more ethical, and more effective radiology practice in Nepal. Thank you. Thank you very much for hearing me out.